Welcome to Raaonline teaching program. So today's topic of discussion is going to be on neoplasms of the liver. So in general, if you see, the hepatic tumors are generally rare in children. Okay, so of which the primary hepatic tumors, it constitutes approximately 1% of all the malignancies in children less than 15 years of age. So generally the primary hepatic tumors accounts for less than 1% of all the malignancies less than 15 years of age. Out of this 1% malignancies, major malignancies are 50 to 60% hepatic tumors are malignant in nature. So, hepatic tumors itself is very rare, and if it is present, almost 50% are malignant in nature. In that malignant nature also, more than 65% are hepatoblastomas. Okay, and the remaining are hepatocellular carcinoma. So, in general, hepatic tumors like hepatoblastomas are more common compared to hepatocellular carcinoma. So, this thing only you have to remember. So, this is regarding primary hepatic tumors. In case of secondary tumors, secondary hepatic tumors that may arise because of metastasis. Many primary tumors will have the predilection towards the liver metastasis. So, some among them are more common malignancies in children, that is neuroblastoma, Wilms tumor, non-Hodgkin's lymphoma. So, all these things, tumors or the primary tumors will have the secondary metastasis in the liver. So, primary hepatic tumors in general rare, that too malignant if present, the hepatoblastomas are more common. As a metastasis to the liver, the more common malignancies, childhood malignancies are neuroblastoma, Wilms and non-Hodgkin's lymphomas. So, this is regarding the hepatic tumors. Benign hepatic tumors can also occur. So, benign hepatic lesions can also occur. They are usually present at around 6 months of age. The benign lesions. The names of benign lesions are hamartoma, hemangioma and hemangioendothelioma. Okay, so with this introduction, we will move on to the most common, the two in hepatic tumors, hepatoblastoma, which is the most common malignant tumors. So, regarding hepatoblastoma, if you see, etiology still remains unknown. Predominantly, the age group involved is less than 3-year-old. Hepatoblastoma occurs predominantly. The median age at the time of diagnosis is 1 year. So, these are all the facts which has been given in Nelson's recent 21st edition. So, hepatoblastoma predominantly in children less than 3-year-old. The median age of diagnosis is 1 year. So, regarding etiology, it still remains unknown. But few strong associations with hepatoblastoma has been seen. So, if you see, hepatoblastomas are strongly associated with a familial adenomatous polyposis syndrome. That is because in familial adenomatous polyposis, there is alteration in the APC, that is antigen presenting cell beta-catenin pathway. That is also found to be in most of the tumors, hepatoblastoma tumors, while during evaluation. So, this common alteration has a strongest association between hepatoblastoma and familial adenomatous polyposis. Second one is the Beckwith-Wiedemann syndrome. In Beckwith-Wiedemann syndrome, that too particularly the hemihyperplasia producing gene, that is the increased expression of IGF-2, that is insulin growth factor 2, which is secondary to the genetic mutations, is also been implicated in the hepatoblastoma that is developed in patients with Beckwith-Wiedemann. So, these two associations are very popular in hepatoblastoma. And third thing is the prematurity and low birth weight. Because of increased survival rate of very low birth weight babies nowadays, even the incidence of hepatoblastoma is been increasing. So that's why that may be the reason. Because of the survival of low birth weight babies, hepatoblastoma incidence is also seem to be increasing in the recent years. Other associations are Aicardi syndrome, trisomy 18 and other trisomies. So these are all the strongest associations of hepatoblastoma. So moving on to the pathogenesis. So in the pathogenesis, if you see, the hepatoblastoma, the cell origin is the precursor of hepatocytes, right? The tumor origin is from the precursor of hepatocytes. So the histological classification of the hepatoblastoma is very important because the histological subtype has a direct link to the clinical outcome. So based upon the histological subtype, we can predict the outcome of the tumor. So that is very important. So the site of origin or the cell of origin is the precursor of hepatocytes, and it is again based upon the histology, it is divided into two. First one is the whole epithelial type. Whole epithelial type, which involves only the fetal and embryonal epithelial cells. And second type is the mixed. Mixed contains both epithelial and mesenchymal elements. Okay. So this whole epithelial type, further it can be classified into fetal, pure fetal histology type, pure fetal histology subtype, and small cell undifferentiated subtype. Why we are more stressing about the histological classification of hepatoblastoma is, again, it has a direct correlation with the clinical outcome. It has a direct correlation with clinical outcome. So that's why the type histological diagnosis is very important. Why? Because this pure fetal histological subtype has a good prognosis, whereas the small cell undifferentiated subtype has the worst prognosis. Okay, so this is regarding the pathogenesis of hepatoblastoma.